What is tonsillitis?
See, tonsillitis, we can say in a bigger spectrum that it is a tonsil infection of a tonsil. It can be anything. It can be a bacterial infection. Most 80 to 90% of the times it's a bacteria which affects the tonsils.
Cold also can lead to tonsillitis?
Yes, cold can be a co-supportive of tonsillitis.
Okay. Is there any medical treatment?
Yeah, tonsillitis can be treated medically. You can give antibiotics, as I said. Antibiotics you can give. It settles down. And whenever there is an episode of infection, you can give antibiotics and serially you can go. See, we have a lot of patients, those who don't want to get the tonsillectomy done.
Correct.
So whenever there is an infection, we give an antibiotic, it settles down, so it goes on.
So is there any home remedies which can be followed for the tonsillitis?
Home remedies, supportive remedies, definitely you need to take an antibiotic, but gargling with salt water, honey gargles, taking turmeric with milk, that will all soothe the throat.
I want to know what is adenoids and what is adenoid hypertrophy?
Adenoids are similar to tonsils. How we have tonsils in the mouth, we have adenoids which are sitting just behind the nose. It is behind the nose and above the tonsil, you can say.
Okay.
So there is a small space, which is the nose is here, the tonsils are here. So a space behind, which is called nasopharynx, where you have adenoid sitting.
So what is nose block?
Nose block is when a person is having a breathing difficulty to breathe through the nose. As we normally breathe through the nose, we have a cycle of 8 hours. So we breathe 8 hours from one nostril and the other with the other nostril. Never in our life are both the nostrils will be working together.
Is it?
It is always that there is always a cycle of 8 hours where you'll have an alternate cycle will be there. So a nose block is when the patient is not able to, the person is not able to breathe through the nose. He has to struggle breathing. He has to open his mouth and breathe.
Welcome to India's first health podcast channel, National Health Diary. Today we have Dr. Suhail Gaur with us, who is an ENT specialist and is also a head and neck surgeon. Welcome, Dr. Suhail.
Thank you. Thank you, Ashutosh. Hi, I'm Dr. Suhail Gaur. I'm an ENT surgeon and an head and neck surgeon too. I have been practicing in Bangalore since almost 6 years and I have finished my DNB in 2017. Since then, I have been an ENT practicing. I have been working in a couple of hospitals, but now I'm settled in Bangalore at present.
And today's topic is tonsillitis.
Yeah.
So I would like to ask, sir, what is tonsillitis?
See, tonsillitis, we can say in a bigger spectrum that it is a tonsil infection of a tonsil. It can be anything. It can be a bacterial infection. Most 80 to 90% of the times it's a bacteria which affects the tonsils. See, there are a lot of bacteria in the mouth which can cause infection. But some of the common bacteria are streptococci or staphylococci which can cause infection. In adults and kids, both we can get tonsillitis.
Okay.
So in adults, if we get, it is very common to have in adults because they would be having it from a very long period of time, been going on from years together since they were childhood and not getting it removed or just getting it treated and just pushing it over. But in kids, we have tonsillitis, which can initially be treated if we take care. See, then later on, the infection rate would be reduced. Their health and all won't be affected. And there is major issues in tonsil infections that it can go to a later stage where there is a lot of infections can be there.
Sure. So I also want to ask, what is tonsils in the first place?
Tonsils are two sets of small ball kind of thing which are sitting inside the mouth. When you open your mouth, the first thing you see inside the mouth after the tongue is these tonsils which are popping out towards you.
Okay.
So these two, in some people you will see it a very small thing, but in some people it will be closely attached to each other, showing you their faces.
Okay.
So that means when they are showing their faces and it is large enough, that means that has to be done something with it.
Okay. Is it required in the body?
See, initially, definitely when we are small, I have been there, you will be there. We have tonsil infections from childhood.
Okay.
So initially it is for the, immunity purpose in the body. But after particular age, we can remove it because it doesn't act as an immunity because other body systems get developed.
Okay. So you mean to say the first few years of the life, say 1 or 2 years or 3 years, up to 3 years,
yes,
it is required. Post that, actually it is not serving any purpose. If it is bothering or if it is creating an issue, it should be removed.
Yes.
Okay. Sure, sir. So, and tonsillitis, how somebody can find out that, okay, they are suffering from this particular problem?
So the symptoms of tonsillitis will be the patient will be coming to a doctor saying that he is having severe throat pain. Okay. He's not able to swallow. Even his saliva swallowing will be difficult to him. And when a doctor observes or he himself observes in the mirror or a doctor sees, he will be having the tonsil will be bright red or there will be white spots on the tonsils.
Okay.
So where you can see, there is a tonsillar infection which is causing all the problem. Plus there will be fever associated with it.
Okay.
Because whenever there is an infection, a bacterial infection, there will always be fever with it.
Okay. Sure. And why does it happen? Like why somebody will be suffering from the tonsillitis?
Tonsillitis can cause, I told you, it can be any bacterial infection which hits you.
Cold also can lead to tonsillitis?
Yes, cold can be a co-supportive of tonsillitis.
Okay.
If you have recurrent cold, then the immunity goes down, then the bacterial infection can act on.
Okay. So you mean to say the cold happens, viral infection happens, and it can lead to the bacterial infection.
Yes. And we have superimposed infection, which we call it. Okay. So that can be there.
Sure. And how do you confirm that okay, somebody is actually having the tonsillitis? Say some patient has come who has presented you with the fever, and you have seen that okay with the torch or something that okay it has been swollen. So is that only the site itself confirms that okay the patient is of tonsillitis, or you need to do some confirmation?
No, the site itself, the clinical examination is the best method of saying whether you have a tonsil or not. Okay. Because the tonsil will be big. It will be either big, red, or it will be spots on it.
Okay.
Whitish spots most of the time. So that confirms that it is follicular tonsil or it's just a plain tonsil which is there. So we have to treat accordingly.
Okay.
See, if many patients will have more than, usually what we do is, if the patient or a kid is having more than 3 episodes in a year, then we advise them to remove the tonsils.
Okay.
So it is the criteria which is set by WHO.
Okay.
It is not that you come once and you have a tonsil and we'll say you remove it off. It is not like that. So we have to do a serial follow-up. We have to see whether they are getting 3 infections in a year, then definitely. If they are not, then we should leave it alone.
Okay. So if a child is getting 3 times sick because of tonsillitis, then it is advised that we should remove the
tonsil. With fever. If the child is having
with fever. Not
tonsillitis with fever.
Tonsillitis with fever. Okay. Sure, sir. And is there any medical treatment?
Yeah, tonsillitis can be treated medically. You can give antibiotics, as I said. Antibiotics you can give. It settles down. Then whenever there is an episode of infection, you can give antibiotics and serially you can go. See, we have a lot of patients, those who don't want to get the tonsillectomy done. Correct. So whenever there is an infection, we give an antibiotic, it settles down. So it goes on.
The first few episodes, you try to settle it down with the antibiotics. And if at all it repeats more
recurrent,
than 3 times,
then it is better to remove. We advise to remove it.
So is there any home remedies which can be followed for the tonsillitis?
Home remedies, supportive remedies, definitely you need to take an antibiotic, but gargling with salt water, honey gargles, taking turmeric with milk, that will all soothe the throat.
Okay.
These are
basically it will help to
soothe the area. Soothe the area.
But that is not the treatment.
Not the treatment.
Okay. The ultimate treatment is antibiotic or the removal of...
See, previously they used to say, some people still come, they say that our old people used to press the tonsils from inside, it used to burst and the problem used to be solved. Okay. But we don't know how it was and how did it work.
So olden days there were many other methods.
Yeah.
But now in the modern science,
there are antibiotic or tonsillectomy.
The removal of the glands. Thank you so much, sir. It was very great information what we have got, and I think this is very important that many parents should know that what is tonsillitis and what is the treatment line of it.
Yeah, true.
And also I have few more questions.
Sure.
That okay, when to seek the medical treatment? So the day the child says that I have a throat pain, or they see okay the child is not able to swallow, they should immediately rush to the doctor, or they should wait for something?
So definitely they should rush to the doctor and they should get it treated, because what happens is if you leave a tonsillar infection, then it can also lead to a complication where we call it as a tonsillar abscess.
Okay.
A tonsillar abscess is where a tonsil is sitting. Behind the tonsil there is a lot of empty spaces. So the infection will go into the space and then there will be a bigger swelling, and then that can also be a swelling outside the neck also, or inside the mouth, where the child won't be able to swallow, won't be able to drink anything. All this, it can happen in adult also, the same thing. So it's always better to get a medical advice, get it sorted as soon as possible to avoid complications.
Can someone die from tonsillitis?
See, tonsillitis, yes, it can happen. We have not heard of it much. In my practice, I have not seen, because see, tonsillar infection, as I told you, abscess can be formed, and if an abscess is formed in the body, it can go anywhere.
Okay.
Because from top to down, it is all connected, so we don't know where it will go. But
Can it
dying
lead
is
to
very rare.
sepsis?
Yes, it can definitely lead to sepsis.
Okay.
Because it's an abscess. Abscess is an infection, so it can lead to sepsis.
Yeah. So ultimately, right treatment at right time is very important.
True.
Sure.
See, and the parents and all, they should not be afraid of getting the tonsils out or removed, because if you keep it, also it is of no use. And definitely, I'm not saying that if it is not having any problem or they are fine, you may remove it off. But if they're having problem, then definitely you should take care of it.
Sure. Any 5 advices you want to give to the parents or to the adults who are actually having tonsillitis?
The only advice is that if you have any tonsillar infection or you feel that you have a throat pain, swallowing difficulty, do visit the doctor, get it treated medically, and please keep a regular follow-up, get it treated. And if you feel that there is an advice from a doctor to get it removed, please do it.
Okay. Is it preventable? How can someone...
Yes, it is to some extent preventable. In kids, we should avoid giving them cold items or anything which will trigger their immunity, lower immunity to be triggered. That we have to avoid. So nowadays, a lot of kids we are giving them junk food. We are only providing them junk food, right? So we have to avoid that. So we have to try to give them homemade foods, avoid giving them ice creams, all these things to a longer extent. Give them on a little bouts. That will be fine. So that is all.
Not very frequently.
Not very frequently. Don't let them eat outside frequently. See, eating outside is not good for anyone, neither for an adult, not for a kid.
Right.
Because on a long term, that will definitely affect us.
So it is even worse for the children if they eat
Definitely.
compared to adult.
Definitely.
They will have more implications.
Yes.
Health implications.
Yes, sir.
Sure, sir. Today's topic is adenoid hypertrophy, sir. So I want to know what is adenoids and what is adenoid hypertrophy.
Adenoids are similar to tonsils. How we have tonsils in the mouth, we have adenoids which are sitting just behind the nose. It is behind the nose and above the tonsil, you can say.
Okay.
So there is a small space, which is the nose is here, the tonsils are here. So a space behind, which is called nasopharynx, where you have adenoids sitting. See, adenoids are usually in kids of 0 age till they become 9 to 10 years of age. Usually what happens with a particular age, it starts reducing in size. By the age of 9 or 10, it will disappear.
Okay.
And the adenoids which are there, they are helpful in immunity at an age of 2 to 3 years in the kid. After that, it is not much required.
You mean to say up to 3 years, it is actually required for a functioning of immunity. But after 3 years, it is not required.
It is not required.
Okay. So, and what is adenoid hypertrophy then?
Adenoid hypertrophy is, see, we have a grading of adenoids, where you have grade 1 will be 25% or 25%. Grade 2 will be 25 to 50%. Grade 3 will be 50 to 75. Grade 4 will be more than 75. These percentages, depending how much area does it cover behind the nose.
Okay.
If it is 100%, that means it's completely obstructing. There is no space at all for the kid to breathe. Where it is 50%, means there is 50% of space to breathe. 25% means 25% space to breathe. It is like this.
Okay. So it means it is actually growing in size, which is unusual size.
It is already grown.
Okay.
It is already big in size when the kid is born.
Okay.
It starts reducing in size after a particular age.
Interesting. So if it is the hypertrophy, doesn't it really mean that
that it is growing?
Growing, correct.
It is already grown.
Okay.
It should reduce in size as the age progresses.
If it is not reducing, that is the problem.
That is the problem. It is not like tonsil, where tonsil is growing.
Okay.
So it's different. This is reducing. It is not reducing. That means there is a problem.
Okay. So it should be reducing at certain speed, but if it is not reducing, ultimately it is obstructing the way of breathing. Okay. Sure. So how would a parent know that, okay, the child is suffering from the adenoid hypertrophy?
That is interesting, because a lot of us, we don't know why the child is having a nose block. Why is he breathing through the mouth? Why is he snoring in the night? All these things are related to adenoid. See, when the child is not sleeping well at night, he is having a very disturbed sleep. He is tossing on the bed for sleep, or he's having breathing difficulty at night, he's opening his mouth in breathing, he's snoring, then there is drooling of saliva. All these things are indication of adenoid hypertrophy.
Okay.
In most of the kids they will have protrusion of the upper jaw. The teeth will be protruding out. That is because they are opening the mouth and breathing.
Okay.
So adenoid can lead to mouth structural problem also.
The whole structure of the face
Face
can
also
change.
distort. Yeah.
Okay. So if at all a child is snoring and tossing in the bed, they should be seeking a medical help, or
Yes.
at least discussing with the doctor.
Yes,
to
they should
understand.
discuss with their pediatrician, because usually they go to the pediatrician, then the pediatrician will advise them whether they have to go to an ENT.
Correct.
So definitely they should get an advice from the pediatric and then follow up with an ENT.
Okay. So and they should not miss out on these symptoms.
Yeah, symptoms.
Okay, they should pick it.
Yes, they should be knowing that what the child is having and why is he not sleeping, why is he having a disturbed sleep. All these things should be there.
No. Sure. And so we were discussing that how we can actually prevent the adenoid hypertrophy.
Adenoid hypertrophy cannot be prevented as such, but definitely if it is there, we can do medical management and improve the symptoms of a child on a long run.
So it can be treated.
It can be treated.
What are the treatment lines, sir?
See, treatment lines are we can use nasal sprays. That is the only thing which is beneficial for the kid if it is not so bad or if they are getting treated. Nasal sprays are to be used at the night for a longer duration, maybe 3 months, 6 months, and we follow up the child, see them symptomatically how they are improving. Or the parents are the best judge. They will tell us how they are improving.
Okay. And is there any surgical treatment for this?
Yes, there is surgical treatment for adenoids. The adenoids can be removed surgically. The surgery is done intraorally or from going through the nose. There is no cutting of any of things outside. It is all done intranasal or from the oral cavity. So we burn the tissue of the adenoids and we make space inside.
Okay. So why somebody should be going for the adenoid surgery?
Yeah, that is one thing which we need to see is because adenoids, if it is hypertrophied, it can also affect a child's hearing also, because it is sitting just beside the opening of the tube, which is called the eustachian tube, which is the hearing tube. So it is large enough and it is two tubes are there aside. So if it is big, so it will compress the tube which is sitting. So there will be fluid collection behind the eardrum and the child will have ear aches, or there can be sometimes a hole in the eardrum because of the pus getting collected behind the eardrum. So that's why we have to treat the adenoid to avoid all that complications.
So if it is not treated, the child may not be able to hear for lifetime.
Yeah, the child can have a lifetime longer hearing loss.
Hearing loss. Okay. Sure. So is there any 5 advices you want to give to the parents?
Yeah.
Regarding the adenoid hypertrophy.
Adenoid hypertrophy, the parent should be prompt enough to know why the child is having a nose block, why is he not sleeping well, why is he having a ear pain, whether the ear pain is related to this cold or it is related to something else. If he is having recurrent cold episode, that means there is something blocking behind the nose or a nose block. That is something behind the nose which is not letting the air go inside, and ear pain which is not letting it settle down. The fluid is not getting out of the ear, because the mechanism of the ear is the fluid should drain out. If it is not draining, that means there is something catching hold of it there. So all these things they should come to know. They should be aware of.
Sure. So in adult, will this adenoid hypertrophy can happen?
Yes, in adults also there could be adenoid hypertrophy.
But you said after 9 years it may not
disappear. I said it should disappear. But in some adults, we see that it is not disappeared. We have patients 14 years, 15 years of age, those who still have adenoid hypertrophy, and then we have to remove it because they have symptoms of nose block, breathing difficulty, snoring, all these things will be there.
Okay. How do you confirm in an adult or child that, they are having the adenoid?
We do an X-ray of the nasopharynx. We do a space behind the nose, which we call nasopharynx. The X-ray is done for confirmatory. We can do CT also in adults. But in kids, we prefer doing a X-ray.
You mean to say, as per the normal physiology, after 9 years, it should disappear. If it is not getting disappeared, it should be removed, or if it is troubling, then only it should be removed.
If it is troubling, then it should be removed.
If it is not troubling, well,
you can leave it alone.
Is still there,
if it is there, you can leave it alone.
We can leave it. Thank you. So what is nose block?
Nose block is when a person is having a breathing difficulty to breathe through the nose. As we normally breathe through the nose, we have a cycle of 8 hours. So we breathe 8 hours from one nostril and the other to the other nostril. Never in our life are both the nostrils will be working together.
Is it?
It is always that there is always a cycle of 8 hours where you'll have an alternate cycle will be there. So a nose block is when the patient is not able to, the person is not able to breathe through the nose. He has to struggle breathing. He has to open his mouth and breathe. All when he has struggle having a breath of spell, you can say. So that is a nose block.
Okay. So this can happen only in the night time or also daytime?
So it can happen during the daytime also.
Okay.
So daytime, it could be associated with any allergic symptoms also. If a person has an allergy, then also he can have a nose block if there is not a structural problem.
Okay. What all can be the reason for the nose block?
Most common reason for a nose block in adults is a structural problem.
Okay.
If the structure is not proper, the anatomically inside the nose, if the nasal septum, which we call, if it is not in the center and it is going towards any one of the sides of the nose, then there could be blockage in the nose. And that could cause a nasal septal deviation, we call,
Okay.
which can lead to nose block.
Okay.
And plus, we have small structures which are called turbinates, we call them. There are 3 to 4 turbinates in the nose. These structures respond to allergy. So if they increase in size, it will block the nose more. So that is the thing.
So is there something like acute nose block, chronic nose block?
See, if a person has a nose block, it will be definitely chronic because he'll be having from a very long period of time.
But sometime in the cold, if we get cold,
then we have a nose block.
Yeah.
That is related to allergy, as I told you before.
Okay.
So that is the turbinates which gets enlarged. See, the person already has a septum which is bent towards one particular side. On that, plus the turbinates gets enlarged. So whatever space he had, that is also gone.
Okay.
So that means he's completely blocking.
So nose block can lead to what all complications?
See, if the person is having a nose block, he can also get dryness in the mouth,
Okay.
which can also lead to breathing, foul smell from the nose. Then he can also get acid reflux due to that. See, the common reason sometimes of foul smell is mouth breathing and acid reflux.
Okay.
See, so it is a very close entity where you can't differentiate much if you have a nose block or when you have a foul smelling from the nose. Is it due to the laryngeal reflux which is there, or it is due to the blocked nose which you're having, or a sinusitis which you're having?
Okay.
So all these things has to be ruled out eventually with a separate entity.
Okay. So many times even this mouth breathing or dryness of mouth is going unnoticed.
Yes.
So how can someone know that, okay, they are actually mouth breathing in the night during sleep? How can someone know?
See, the person himself won't be able to know whether he is mouth breathing, but his partner or whoever is there in the family can definitely tell him whether he is having a snoring related to mouth breathing or he has just opens his mouth and breathe. Because 80% of the time, what happens if the nose is blocked, we tend to open the mouth and sleep. So once that becomes an habit, so the dryness of mouth will be there. Then you'll have other problems like sleep apnea can also occur after that.
Okay.
Because there will be the palate will go down, the tongue will fall back, all these things will happen.
Okay.
So you can say that a nose block, a septum deviation is a part of OSA also.
Okay. So we can, even nose block can be associated with obstructive sleep apnea.
Yes.
Okay. And what are some other complications on other organs can it impact?
See, if you have a nose block, if it is persistent, then there could be stasis of the mucus flow which is there inside the nose. It should be going at a particular flow. That will also get obstructed. So you can have sinus infection.
Okay.
So there will be filling of pus inside the sinuses. Then you'll start having headaches, nose block, breathing difficulty, facial pains. All that will be there.
Okay.
So nose block can lead to sinusitis also.
Okay. How do you find out do you find out when somebody is presented, any patient is presented with nose block, do you find out about the root cause of that or do you start treating symptomatically?
See, when the patient comes to us with a nose block, we see it clinically. Clinically on examination, you will come to know whether how bad is the septum deviation he has. Then further we also do a nasal endoscopy. Okay. And we see whether he has any pus collection inside the nose because of the deviated septum. or we can also do a CT scan to see how bad is the septum which is deviated and how much is the infection which is deviation is leading to. So we can come to know with that.
No.
And then accordingly, if there is a lot of problems with sinusitis, or if there is less deviation and sinusitis, we can treat surgically, or medical management can be given accordingly.
No. Surgically, you will remove the part which is obstructed.
Yeah, we do it from the nose. Everything, no cutting from outside. It is surgically corrected from the nose inside. The bend is made straight.
Okay.
And it gets treated.
How we can differentiate a nose block between in the babies and the adults?
See, babies or children usually will have an adenoid hypertrophy, as we had talked before. So adenoid and tonsil can cause nose block and mouth breathing in kids or children.
Okay.
But in adult, it is a different case, because in adults, the nasal bone is completely developed up till the age of 17, and after that, it is developed. The chances of being an adenoid hypertrophy is very less in adults.
Okay.
So in adults, it will be mostly because of the nose block and sinusitis, and in kids, it will be basically because of adenoid and tonsils, which is there. Eventually, in both the things, if it stays for long, OSA will be the next, which is there.
Okay. So, anyways, if there is a nose block, it should be ruled out by meeting the proper
Yes.
ENT physicians or the primary doctor.
Yes.
Okay. What are some advice you want to give to the people who are suffering from the nose block? How can they pick up they are actually suffering from it?
See, nose block is a symptom. In day-to-day life, we will have patients who come up with having nose block, breathing difficulty. So they themselves will be very sure that they will say that my one nose is blocked, the other nose is blocked. There is always an alternate blockage in the nose, or there is persistent blockage in the nose. So they themselves, they will walk and they will tell us that what is their problem.
Okay.
So they are self-symptomatically, they will tell us.
Okay.
So the only precaution they have to later on take is that, see, the bone can't be corrected with medications.
Okay.
If you have a fracture, you need to reduce it. You can't just wait for it to heal by itself unless and until you do a plaster or do something. So same way, if a bone is bent, so it has to be surgically treated. Medication doesn't help in that case.
So that means the right decision needs to be taken.
Right decision needs to be taken at the right time. See, if you don't operate at the correct time for a nasal septum, that can lead to sinusitis and infection of the sinuses. Then instead of getting one surgery treated, you will have to end up getting a sinus operation also done.
So multiple
complications and multiple things and multiple medications and all things will be there.
Right. Sure, sir. Thank you so much for joining us
Thank
today
you very much.
to have discussion about the nose block. It was very informative.
Thank you very much.